My name is Deborah Yu. I'm a plastic surgeon here at the Plastic Surgery Center. Filler is basically substance that can be injected, usually underneath the skin, used to fill defects, right? So whether it's depressed scars, loss of volume with age, or just looking to increase the volume that already currently exists. There are two main types of fillers. There are fillers that are more permanent, meaning that they last quite a long time and potentially forever. And then there are fillers that tend to resorb or they dissolve over time. So a patient comes to me usually desiring filler, often when they want to look a little bit younger, but they aren't interested in having surgery. Or there's an area of their face, typically, that they'd like to enhance, whether it's their lips or they would like higher cheekbones. Those are usually typical reasons. So on the day of filler, a patient should come without any makeup. And if not, we'll obviously use some makeup remover and clean off the face with alcohol as well. Patients should expect to be there it's not a quick, as one patient recently termed, she thought it was going to be as quick as getting a vaccine. And I would not say that. I would, budget at least about half an hour, really to get an optimal result. To me, it's a bit of an art. And so it's making sure that the patient is happy. The patient should expect that there could be some bruising on the day of, and even though all best efforts, we try to prevent that, that can occur. There may be some swelling after the procedure as well. I will send patients home with ice packs, typically with instructions for 10 minutes on, 10 minutes off. So after filler, initially the first few days, the patient's going to expect to have some swelling. And depending on where the filler was placed, the swelling can be a lot more dramatic than others. For instance, filler in the lips, you can look like Donald Duck with huge lips the first few days. I would say swelling can peak at typically about 3 days afterwards. So oftentimes patients may want to sleep on extra pillows, etc. No makeup for 24 hours and really no strenuous activity for those first 24 hours. After about a week or two, the swelling has decreased at that point. And so you really start seeing what the end result is. And at that point, if a patient would like some more or they're not particularly happy, I always ask patients to come back in. But long term, in terms of how long will these fillers last, again, it depends on what filler is chosen. If you've chosen a more permanent filler, that could last for years on end. But in terms of the ones that tend to absorb more, those can vary. There's some that last about 6 months, some that can last up to 2 years. Oftentimes patients come in before that because they're used to their new appearance with their filler. So they're not going to wait for all of the filler to dissolve before they come back in for repeat treatment.